At the end of the day, all of those injections, so the dextrose prolotherapy, the PRP, the adipose tissue, the bone marrow, all of them are trying to accomplish the same thing, which is a reduction in inflammation, a reduction in pain, an improvement in your quality of life and function. And along the way, we usually get some form of tissue repair. It's not technically a true regeneration. We are not turning old cells into brand new cells. What we're doing is we're getting some form of repair that is occurring, which is different than regeneration.
Okay.
And so the more advanced the condition, generally the stronger stimulus we are going to need. And so what that can mean one of two things. Either we need to do a stronger therapy, meaning we're looking at doing a bone marrow and or adipose tissue injection, or it just means we can do PRP, but we plan on doing more than one. And so we might need to do 3 or 4 treatments spaced out over a 9 to 12 month period, as opposed to just maybe only needing to do one bone marrow and adipose treatment within that 1 year period. So there are some instances where certain things are going to be better. So as an example, this is not for the neck, but in the shoulder, if somebody has a large defect in their rotator cuff tendon, so there's a big hole from a tear, dextrose prolotherapy is not going to be strong enough to create a strong enough healing stimulus for that. Generally, we need to introduce some adipose tissue, because that adipose tissue, the fat, has actual structure to it. And with that structure, that's actually going to help fill that hole such that new cells can hopefully try to migrate into that area and create a healing response. You're not going to get that with dextrose. You're not going to get that with PRP, because those things are liquid, whereas the fat is actual fat. And so it's globular, and so it has structure to it, and it's going to stay there longer. So there are some nuances like that that help us to differentiate between which injection we might recommend. The other thing too is, even though this is an emerging field, there is some published literature, on outcomes. And so we'll also look to those outcome studies to see, okay, in this type of patient population with this type of condition, what does the research show on, a PRP injection versus a bone marrow injection? There are some instances where PRP and bone marrow have been shown to be equally effective for certain conditions. Example might be very mild knee osteoarthritis. And so in that situation, we tell people, hey, why spend the money on a bone marrow when we know that you're probably going to get just as good a results because you have a milder condition of osteoarthritis, and we can just do PRP and save you money.